Postpartum hemorrhage occurs in about 1 to 5 of every 100 child deliveries. It is the leading cause of maternal mortality worldwide. Today on Sound Health, this is our focus. Good evening. Welcome to Sound Health on Lagos Television. I am Olasumbo Mudukwe. The conversation begins after this break. The program is still Sound Health on Lagos Television. Joining us via Zoom to talk about how to reduce postpartum hemorrhage, one of the leading causes of maternal mortality worldwide, is Toyin Odukoya. She is a retired midwife and former head of nursing services with the Lagos Primary Health Care Board. Good evening, Toyin Odukoya, and thanks for joining us.
Thank you. Good evening.
All right, before we look at why postpartum hemorrhage is one of the leading causes of maternal mortality worldwide, let us know what exactly is postpartum hemorrhage.
Okay, postpartum hemorrhage is a severe bleeding after delivery of the placenta, and it can last up to 12 weeks. So there's primary postpartum hemorrhage and there's secondary. The primary one should be within 24 hours, while the secondary one is what you have from like 1 week to 12 weeks of delivery, after delivery.
All right, why is this still the leading cause of maternal mortality in Nigeria as well as worldwide?
It's worldwide because the causes of postpartum hemorrhage majorly is atonic uterus. We call it atonic uterus because the placenta might refuse to go back to its normal place. The contraction might not come in as it should be. Thereby, the uterus will be relaxed and there will be bleeding. And because of the atonic uterus, it's always very difficult for people to diagnose or to know that this thing is coming. We only know the beginning of labor. Nobody knows the end of labor. And because in our own society here, majorly most of our people patronize uh, home-based delivery centers. And at the delivery centers, they might not know exactly how to tackle it. And if you say, like in Lagos State, majority of our people deliver there, like 80% of our pregnant women patronize home-based TBA delivery centers. So definitely, if such things happens, it might be difficult for them to manage the case, and eventually the woman will lose more than the necessary blood, because any woman that loses over 500 mils of blood, that's termed postpartum hemorrhage. And secondly, there might be a retained product. Retained products in the sense that the placenta, little of the placenta might be holding in the uterus, and it has to come out. And if you are not that experienced as a midwife, you might not know, because there's a way you examine the placenta and see that all the things, all the membranes are complete. Hence, you will prevent that woman from bleeding herself out. That's another cause. For the secondary one, infection can cause it, because if after delivery the place is still raw, if the woman did not take care of herself very well, definitely the infection can come in, and this infection can really cause uh, bleeding for the woman. That is the secondary aspect of it. And clotting time, some people, they have this clotting problem that have been discovered during their antenatal clinic. And when they deliver, the patient will just continue to bleed. You know what is happening. The woman might die if it's not in the proper hand and it's not properly handled. So
Okay,
those are the things that
okay.
make it to be number one.
All right. In your response, you said nobody knows the end of a delivery process. We only know about the beginning. How much blood
Yes.
do you think a person can lose before you say this person is experiencing postpartum hemorrhage? And is this more common in assisted birth delivery or cesarean section?
It's common, even in cesarean section, the amount of blood that you will lose that they will is if it's normal delivery above 500 mils, it's being termed as PPH. If it's cesarean section above 1000 mils, it's being tagged as a PPH. So it can happen in both, whether it's either cesarean section or normal delivery, because I mentioned it sonic uterus. Even after cesarean section, the baby is out and the massaging and whatever cannot be done then. So if the uterus did not go back to its place, the woman can start bleeding after the section. So those are the things that happens.
All right.
500, over 500 for normal delivery, over 1000 for cesarean section.
Is it just about bleeding profusely after birth or during birth? Are there other symptoms a midwife should look out for?
Actually, majorly, when we talk of postpartum hemorrhage, it's bleeding. It's about bleeding. The midwife will look out for certain things. You have delivered a patient, and the patient, the placenta is out, and you have assessed the patient, and you discover that this patient, the bleeding, the quantum, the weight of the the volume of the blood is more than required. So the first thing you do is to look out for if there is a retained product, you examine your placenta again to be sure it's not retained product. You check if there's laceration within any of the organs, either from the perineum, from the uterus, from the cervix. You check all that, and then you massage the uterus to see if the uterus is contracting well. But while you are doing this, you have to get an assistant. The patient has to be uh, put on IV. You have to give some oxytocin drugs so that while you are examining and doing all this, the blood clots, the clotting system will start. So if it's laceration, you quickly suture the place. If it's within the perineum, if it's the cervical one, you have to invite the doctor to come and do the suturing. And if it is uterus, well, that patient they have to operate on the patient and bring out the uterus.
All right. So, in your years of experience, have you seen situations where, after discharge, a mother still bleeds?
Yes, I've seen a lot of them. I have one terrible experience some years back within my area where I live. The woman delivered and they did the naming ceremony. That night, overnight of the naming ceremony, the woman started bleeding. And they have to call on me because they know I'm a midwife. So when I got there, I tried to rub the uterus to expel clots. Personally, I don't practice at home. But when I got there, I don't have any other choice just to save her life. I tried what I could do manually. And when I realized around 2 a.m. that it's not responding, I have to put the woman in my car and transfer her to
The next
Ikorodu
available,
General
yes,
Hospital.
hospital.
She was taken over there. They discovered that there is a same product and infection too are setting. So, and at the end of the day, the woman survived and she had almost 3 pints of blood within uh, 1 week, within 2 days or 24 hours, because it was a terrible situation. It's only God that saved her. She delivered in a TBA and she's been okay. They did the naming ceremony, elaborate one. The next day, the next house to my house, but the midnight, everything changed. So it happens like that. Even me, myself, my own is the primary one. I delivered in Nyla maternity and everything was okay. They have cleaned me just for me to get up to go and bath, to go and clean myself up properly. And I started bleeding. And if not for the grace of God, I would have gone because all the doctors, all the consultants in Nyla maternity, they were on me. They were just shouting my name. I was just hearing.
Hmm.
I have a blurred vision. I could not talk. They cannot hear me. I was trying to talk, but they could not hear me. So that is the extent and the damage bleeding can do to a woman. So I delivered around 8:30 in the morning, and I could not say anything until 4 p.m. I could not see. I was just hearing voices.
Okay,
So
clearly.
that is why
All right. Please go ahead, ma. That is why. Go ahead with your
I said
point.
that is why it's always good to one deliver in a recognized hospital. All the PACs in Lagos State, all the general hospitals in Lagos State, they have what they can do and how to tackle those things. Even if it's only pupils, you will see the consultants around putting their heads together to determine what to do. So that's the major advice. People should deliver in a recognized place. Although some people will say I normally deliver in my home on my bed, but once you have first and second, you cannot predict the third one that it just goes properly like that. So that's just the advice.
All right. Clearly, from your explanation, it is not just about visiting the TBAs, the traditional birth attendants. We do not know the next line of action during the child delivery or birth process. What should be done to address quackery, and how should government start embracing or incorporating the traditional birth attendants into the maternal care? And what do you think can be done to reduce postpartum hemorrhage when this starts?
Okay. The first question. Already Lagos State is training the traditional birth attendants because we know that majorly our people visit them and they attend their places. But what we are now telling them through this program, through this our community engagement, is that even if they register with them, they should register with the state hospitals, the PACs, and the general hospital by Lagos State. They know their limits. You understand what I'm saying? And as I rightly said before, that you might know the beginning of labor, nobody knows the end of the labor. But those people that are trained, once they notice that this bleeding is getting out of hand, they will quickly transfer the patient to the nearest hospital where she can be given some drugs to stop the bleeding and at the same time look at the causes of the bleeding. You understand what I'm saying? But there are some that were not trained. There are some that they trained and they are not certified and they are practicing. So majorly delay is the major thing that kills our women on postpartum hemorrhage. Because if there is no delay, majority of them will survive. But a patient that delivers in the house and she started bleeding, people will now call the nearest health quack to come and attend to her. And before you know it, that one will call somebody that is more experienced than her. And before you know it, time is of essence when it comes to postpartum hemorrhage. They are wasting time. And the delay is the one that will just, by the time they take the patient to the hospital eventually, the patient will have gone. The TBAs that were trained by the state, they are being attached to the general hospital and they are attached to some recognized private hospital that is very close to government. So if they have issues, all they need to do, once they recognize it, is to transfer the patient immediately to that hospital and they will start treatment. Even at the primary health care center, if after doing all this, giving injection, giving setting up the drips, they could not handle it. We have what we call anti-shock garments. The anti-shock garment will be worn on that woman that will prevent the woman from losing the blood that is going to the heart. The circulation will be reduced within the heart and the brain, and the patient will be transferred immediately to the nearest general hospital where obs and gynae people will take her up and they will look at what is causing the bleeding. So those are the measures that are on ground within Lagos State. Even recently, Lagos State have just opened some uh, emergency clinics within Agege I think Mushin, just majorly to reduce maternal mortality because they said no woman should die while giving birth, which is the slogan and which is what everybody should look into. The major prevention is to avoid delay when this occur.
All right. So, what signs should a mother, a bleeding mother, look out for during this time, during this short period?
During this short period, what I normally advise people on community sensitization is this. You have just been delivered, and the midwife that deliver you or the attendant that deliver you, as you notice that she's going up and down, that is if it's not in the hospital. If it's in the hospital too, you will notice it because the midwife will come back, they will examine your uterus, they will rub your uterus, they will give you injection, they will set up drip. So you will know that you are bleeding, that something is wrong. You understand what I'm saying? The concentration will be on you, even if it's in the hospital. But if it's at home, you yourself, by the time you change this our pad, you change your pad, maybe you just delivered and they ask you to get up and you notice that blood is rushing out, please just ask them to transfer you to the hospital immediately.
All right.
Or you have delivered, you have rested, and you wake up and you see all your body soaked, and you try to change the pad, and within 30 minutes it is soaked again. So it's better for you to tell them to quickly transfer you to the nearest hospital where they can give you some drugs that is available, like TSA is available within our all centers. Transgenic acid is available in Lagos State. So once you get there, they will give you the injection, they will put you on bed, they will examine you to know the cause of the bleeding, and they will do whatever they want to do, at least to save your life. And from there, but if that patient has bled a lot within the delay time, there's little or nothing the PAC can do because PAC don't transfuse. You understand? So the person, when you get to PAC, they will now tell you that you should be going to general hospital. You know the delay. Some general hospital are not very close by. And before you get there, the woman is continuing to bleed. You understand what I'm saying?
Yes.
But what we propagate now, what we tell them, the midwives at different training, is that once they bring them like that, even if you look at the patient, you discover it's getting, just give the patient an injection that will that will reduce the bleeding.
How long can a woman who experienced postpartum hemorrhage recover, and is it also safe to have another baby soon enough?
A woman that has postpartum hemorrhage, uh, I would say it will take some time because they will need to do a PCV and HB to be sure that she has recovered fully. You know, if you lose blood, by the time your PCV is getting low, some will be level. By the time they come out of the PPH, some they will transfuse them 2 pints of blood. Some they will say 3 pints of blood just to build up the blood. So by the time the woman has like 24, 26 as PCV, they will now discharge the woman. They will now tell you to build yourself up at home. You will be given some drugs. You'll be advised to eat uh, rich food in protein, vegetables, fruits to build yourself up. So after a month, that is after a month after the episode, because with PPH, the woman might be in the hospital till like 7 days or even 8 days. So it depends on the strength of that woman. So when you are discharged, you will be asked to come back like in 4 weeks' time so that they will take your PCV and HBV again. They will assess you. They will still notice, they will see whether you have recovered fully or you still need to continue building yourself up. Because you know the woman will still breastfeed. So even if you had 24, 26 before discharge and she started breastfeeding, the blood too, the breast milk comes from the products of blood. So definitely, for her to recover fully, might take like 2 months or 2.5 months. It depends on the individual and how capable you are to take care of your body and what has been on ground. That is how your body has been before. Then For the next pregnancy, the woman needs to at least take it easy. The normal 2 years, if she can wait for the normal 2 years, that is fine. Because if eventually she gets pregnant, maybe 4 months after the delivery, one, she might not have recovered fully. So anemia might be part of the problem that she'll be managing during pregnancy. And somebody that has anemia, there's possibility that the person might bleed after the delivery. So the woman needs to take it easy and wait for like 2 years before getting another pregnancy.
All right, early detection and prompt attention will save a woman from postpartum hemorrhage. Toyin Odukoya,
Yes.
retired midwife and former head of nursing services, Lagos Primary Healthcare Board. Thank you so much for your time and expertise on how to manage postpartum hemorrhage.
Thank you very much.
You're welcome, ma. Sound Health continues with trending health report from around the world. Please stay tuned. A stitch in time saves 9. Severe bleeding, also known as postpartum hemorrhage, often experienced by women during childbirth or after childbirth, can be reduced. It shouldn't add to the leading cause of maternal mortality worldwide. You need to report cases early enough to the nearest health facility. This is why we say thank you on today's episode of Sound Health. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 0035 826603 or follow us on social media at Lagos Television, #Sound Health. A sound health is a sound mind. Make healthy living your choice.